Dementia is the seventh leading cause of death in the world. It affects millions of people and starts silently, often decades before anyone notices the first symptom. Here is the uncomfortable truth. Your genes might load the gun, but your lifestyle is usually the one pulling the trigger. So the good news is, it is not all your DNA's fault. In this video, we will look at the 5 pillars that protect your brain over a lifetime. The 10 nutrients your brain needs most, ranked from important to absolutely essential. And we will answer the question that millions of people are asking. Can one multivitamin actually improve your memory or prevent dementia? Let us be clear from the start. No single pill will save your brain if the rest of your lifestyle is a mess. Supplements are not shortcuts. They are patches at best, and sometimes not even that. Let us start with what actually moves the needle. Researchers at the AARP have built a framework called Staying Sharp, 5 pillars for keeping your brain healthy throughout life. These are not opinions. They are backed by evidence, and they are worth understanding before we even open a single supplement bottle. Pillar 1. Move. Physical exercise is one of the most powerful things you can do for your brain. Not because it sounds motivating in a podcast, because the biology is real. When you move, blood flow to your brain increases, cortisol, the stress hormone that literally shrinks your brain over time, goes down. And your body produces something called BDNF, brain-derived neurotrophic factor. Think of BDNF as fertilizer for your neurons. It improves how they function, stimulates the growth of new nerve cells, strengthens the signals between them, and protects against cell death. Both aerobic exercise and resistance training show cognitive benefits, and the opposite is equally true. A 2018 study found that sitting too much is linked to thinning of a brain region critical for memory. The chair is not your friend. Move. Pillar 2. Discover. Your brain needs novelty, not repetition, new, challenging, and enjoyable. Those are the 3 words that describe effective brain training. Learning a new language, picking up a musical instrument, reading widely, trying a recipe you have never made before. Even people with Alzheimer's can learn new things. Your brain retains that capacity longer than you might think, but only if you keep using it. Pillar 3. Relax. Chronic stress shrinks the prefrontal cortex, the area responsible for memory, reasoning, and planning. That is not a metaphor. It is what happens on brain imaging. Sleep is a non-negotiable part of this pillar. Studies consistently show that sleeping less than 7 hours per night impairs memory, attention, and decision-making. And here is the mechanism. Deep in your brain, there is a structure called the hippocampus. It is your brain's memory inbox, the place where new experiences are received and stored. When researchers scanned the hippocampus of people who had not slept, it looked essentially switched off. New memories were arriving and bouncing back. Nothing was getting in. Sleep also does something even more important. It consolidates memories. It takes fragile short-term memories and moves them into long-term storage in the cortex. Safer, more durable, accessible for years instead of hours. If you think you can skip sleep and compensate with caffeine, your hippocampus disagrees. Pillar 4. Socialize. Human connection is medicine for your brain. Eye contact, physical touch, conversation, these all activate neural systems that isolation slowly erodes. Loneliness is not just unpleasant. It is associated with higher risk of Alzheimer's disease. A 2021 study found that more isolated individuals lose more gray matter, the tissue that processes information, compared to socially connected people. Interact more, especially with people who challenge you, support you, and actually care. Pillar 5. Nourish. A diverse, colorful diet is one of the most important things you can do for your brain. The same foods that protect your heart protect your brain: fruits, vegetables, nuts, fish, eggs, legumes. Here is a number that should concern you. About 90% of Americans are deficient in at least one vitamin or mineral that supports brain function. Not because those nutrients are hard to find, but because the modern diet is remarkably narrow. A handful of staple grains and ultra-processed derivatives dominating most of what people eat. So statistically speaking, you probably have a gap somewhere, and that gap matters because the brain is a highly demanding organ. When key nutrients are missing, cognitive function suffers, and that brings us to the ranking. 10 nutrients your brain needs most, from number 10 to number 1. Number 10. Vitamin A. Vitamin A supports communication between neurons and helps maintain what scientists call neuroplasticity, the brain's ability to adapt and rewire itself. Less plasticity as you age means faster cognitive decline. Good food sources. Carrots, sweet potatoes, pumpkin, eggs, spinach, mango, and papaya. Important warning. Do not go buy an isolated vitamin, a supplement. Research has shown that high-dose beta-carotene supplementation was associated with an 18% higher risk of lung cancer in smokers. And people exposed to asbestos, high doses of vitamin A can also cause liver damage. Get this nutrient from your diet, not a bottle. Number 9. Vitamin B1, thiamine. Thiamine is essential for basic cell function, and specifically for glucose metabolism in the brain. Since your brain runs almost entirely on glucose, this matters more than it sounds. Severe deficiency leads to beriberi, muscle weakness, nerve pain, appetite loss. But there is a more dramatic consequence worth knowing. Korsakoff syndrome, seen most commonly in people with chronic alcoholism, can cause both the inability to form new memories and the loss of existing ones. Best food sources: beans, lentils, peas, sunflower seeds, pork, fish, and yogurt. Number 8. Vitamin B6 pyridoxine. Vitamin B6 supports immune function and brain health. It plays a role in the synthesis of neurotransmitters, the chemical messengers between neurons. One important caveat: much B6 can damage nerves. This happens mainly through supplementation at high doses, not through food. So again, prioritize diet first. Food sources: dark leafy greens, bananas, papaya, oranges, chickpeas, fish, and poultry. Number 7. Vitamin B7. Biotin. Biotin does more than improve hair and nails. Though it does those too, it regulates cellular signals involved in rapid neurotransmitter communication. When those signals slow down, brain processing slows with them. Best eggs. One egg contains about a third of the daily recommended value. Number 6. Vitamin B9. Folate, also known as folic acid in its synthetic form. Folate is famous for its role in pregnancy, specifically in forming nervous tissue during fetal development. But its benefits do not stop at birth. In adults, folate is linked to improved memory, better mood, and a process called methylation that helps detoxify the brain. Sources: dark leafy greens, asparagus, lentils, chickpeas, and cabbage. Number 5. Vitamin B12. B12 is critical for the functioning of your nervous system and for the production of red blood cells and DNA. Its role in brain health is among the most well-documented in nutritional science. Deficiency is more common than people realize, especially in older adults, long-term vegetarians, vegans, and people who have had bariatric surgery or who have autoimmune gastritis. Symptoms of deficiency can include numbness, tingling, memory loss, difficulty concentrating, fatigue, and dizziness. Food sources: meat, fish, dairy, eggs, and some fermented foods. If you are vegetarian or vegan, B12 is one supplement that is genuinely worth discussing with your doctor. Number 4. Vitamin D. Deficiency in vitamin D is extremely common, particularly in older adults, and is associated with a wide range of diseases. When it comes to the brain, vitamin D plays a role in maintaining cognitive function, and low levels are associated with faster age-related cognitive decline. Your best source is not food. It is sunlight. People who spend time outdoors, move their bodies, and live actively tend to have higher vitamin D levels. Beyond that, fatty fish, eggs, and fortified milk. If you are over 60 or spend most of your time indoors, having your vitamin D level tested is a reasonable step. This is one of the few cases where supplementation under medical guidance makes clear clinical sense for many people. Number 3. Vitamin E. Vitamin E is an antioxidant. It combats free radicals, unstable molecules that damage brain cells over time. Low vitamin E levels and high markers of oxidative stress have been found in patients with Alzheimer's disease and mild cognitive impairment. But here is the second major supplementation warning of this list. A large study found that vitamin E supplementation was associated with a 17% increased risk of prostate cancer in men. That is a significant finding. Get your vitamin E from food: nuts, avocados, seeds, and vegetable oils. Do not supplement it in isolation without medical guidance. Number 2. Vitamin K. Research has found that higher intake of vitamin K is associated with better cognitive function and fewer neurofibrillary tangles, the twisted protein structures found in the brains of Alzheimer's patients. That is a meaningful connection. Sources: eggs, milk, and dark green leafy vegetables like spinach, kale, and broccoli. Number 1. Magnesium. Magnesium earns the top spot because of what it does at the level of synapses, the connections between neurons where communication actually happens. Higher synaptic density is directly linked to better memory, faster learning, and more resilient cognition over time. Research suggests magnesium may improve both short-term and long-term memory and may help reduce the risk of age-related memory loss. Food sources: dark leafy vegetables, whole grains like oats and brown rice, fish, beans, bananas, and yogurt. There is also a specific form called magnesium L-threonate, developed and patented by MIT researchers. They report that this form crosses into the brain more efficiently than other magnesium compounds, and in their studies, improved memory, mood, and may even reduce anxiety and depression. Some research suggests it could partially reverse brain aging markers. Important caveat: most of these studies are small, and some have been conducted in animals. This is a promising area of research, not an established medical treatment. Mention it to your doctor before starting. Individual results vary considerably. 2 honorable mentions that did not quite make the vitamin list. Omega-3 fatty acids are not vitamins. They are healthy fats, but they deserve a mention because they frequently come up in this context. Omega-3s can improve triglyceride, raise HDL cholesterol, and have anti-inflammatory effects. They are found mainly in fatty fish, salmon, sardines, trout, and also in walnuts, pumpkin seeds, and chia. Multiple studies have shown that a Mediterranean-style diet is associated with a lower risk of dementia, but here is the important distinction. Omega-3 supplements on their own have not consistently proven the same effect in the general population. The exception may be people who carry a variant of the APOE4 gene, associated with Alzheimer's risk, who may benefit from early omega-3 supplementation. Otherwise, eat the fish rather than the capsule. The second mention. Lion's mane mushroom. This is an edible fungus that some research suggests may support nerve growth and immune function. The evidence is limited and mostly preliminary. It falls into the category of experimental curiosity rather than established medicine. Some people report improvements in memory and mental clarity. Others notice nothing. If you are interested, discuss it with your doctor. Do not treat a YouTube mention as a prescription. Now for the question you actually came here for. Can one multivitamin prevent dementia? Here is the complicated, honest answer. The U.S. Preventive Services Task Force reviewed 90 of the best available studies on supplements and vitamins. Their conclusion: multivitamins do not protect healthy adults who have no nutritional deficits. If you eat a reasonably good diet, taking a multivitamin does little more than produce expensive urine. But then there is this study published in 2022 with more than 200 volunteers over the age of 65, followed for 3 years, found something unexpected. Cocoa extract did not improve memory. But the people who took a standard multivitamin, Centrum Silver, showed measurable improvements in overall brain function, episodic memory, and executive function, meaning the ability to plan and organize tasks. The biggest improvements were seen in participants who already had cardiovascular disease. One well-done study is a reason to pay attention, not a reason to stockpile multivitamins, the most likely explanation. If 90% of people have at least one nutritional gap, a multivitamin corrects those gaps, and correcting deficiencies improves function. That is not magic. That is just restoring what was missing. What this does not mean that a multivitamin treats or prevents dementia. It means that nutritional deficits hurt brain function, and filling them helps. Those are not the same thing. So here is the actual conclusion. Improve your diet, get more movement into your daily life. Both aerobic and strength training. Prioritize sleep as if your memory depends on it, because it does. Reduce chronic stress. Stay socially connected. Learn things that challenge you. The 10 nutrients in this list are not magic bullets on their own. They work when they come from a varied whole food diet that delivers them in combination, with the cofactors and context that make absorption and use possible. Supplement strategically where deficiency is documented. B12 if you are vegetarian, vitamin D if your levels are low, and always under medical guidance. Your brain is not waiting for the right supplement. It is waiting for you to start treating it like it matters. This video is for educational purposes only. It is not medical advice and does not replace a consultation with your doctor. Before starting any supplement, including multivitamins, magnesium, L-threonate, vitamin D, or B12, talk to a qualified health professional about your specific situation. Nutrient needs vary by age, diet, health status, and medications. Do not self-diagnose or self-supplement based on a video.